Hi. What is the knee? What is functional manual therapy? And if you can brief it for our listeners or the audiences, please.
Hi, functional manual therapy. It's a hands on manual technique where we correct the body function through neuromuscular correction, anatomical fixation of structures, as well as treating the body muscle as well as the functions. It is a very different form of technique as opposed to conventional physiotherapy, wherein people usually go for modalities, machines, but in functional manual therapy, it's the root cause treatment, not just treating the symptoms. So
Okay.
I treat the basic root cause, and thereby the patient feels much better. So this is basically involving less number of sessions, yielding maximum results, as opposed to going. If you go to a regular physio, he takes about 10 to 12 sessions in treating a particular condition. And if you come to me, I just take 2 or 3 sessions because I am working on the root cause, which very less physios do. This
Just 2 to 3 sessions.
majorly because we know the anatomy that ways, and that is what is famous in India, because very less physios actually practice manual therapy in India. This is a very western concept, but my company, which is the Times of India, I am lucky to be a part of it, and they have introduced this concept in India. And since very less people know about it, those who know never return back to the conventional physiotherapy, which is amazing. And I feel good to be a part of it because I am able to do justice to so many patients of mine, and they are very happy with the results. So I feel it's a very promising technique. Yeah.
And another question. Since we have a very traditional medical or the hospital setup in India, and which is evolving for sure, uh, how do you see the scope of functional manual therapy in India, and what are the benefits for the users or the patients?
So I have a lot of patient base, which usually not only substitutes to the constitutes of the sports injury patients, but neurological cases, for example, stroke patients, paralysis patients, or any badminton players. For example, I get a couple of those patients: tennis elbow, migraines, headaches, knee pain, osteoarthritis,
Ligament will be
ligament, obviously, orthopedic, musculoskeletal injuries. So they are these patients reap maximum benefit out of it. They all will benefit out of it tremendously, because obviously I also want to give them a quick fix, which is permanent rather than a temporary one. So these all patients can obviously benefit from that, from my functional manual therapy technique. And our founders, Greg Johnson and Vicky Johnson, they keep evolving the techniques because they are the pioneers of this. So we keep learning from them on a day-to-day basis. And as far as the scope of this is concerned in India, I think it has a tremendous hope and scope, because it's all the patients, it's the word of mouth. Once you get the treatment, you know the difference. Once you know the difference, you're not getting back to the original one. So I'm very proud to be a part of such therapy, physiotherapy, and I would be happy to welcome all people who would want to, consult me in future for any sort of minor or major injuries, because I think this is a promising and a powerful one.
all right.